Hello, everybody. I'm Dr. Caitlin Rigler, and today I have the pleasure of speaking with Dr. Jeff Konin, a clinical professor and director of the Doctor of Athletic Training program at Florida International University, where he leads one of the nation's premier doctoral level athletic training education programs. He's a licensed athletic trainer and physical therapist. He holds fellowships in both the American College of Sports Medicine and the National Athletic Trainers Association, and is a member of the National Athletic Trainer Association Hall of Fame. Dr. Konin will be speaking at the upcoming SNS Symposium, giving a talk titled Cannabis and the Brain, the Impact on Performance. Dr. Konin, thanks for being willing to speak to me today about your upcoming talk.
Absolutely. My pleasure. Thanks for having me.
Yeah. So, just to get started, obviously, cannabis is really a hot topic, tons of emerging research constantly coming out. So, can you tell us a little bit about how you first got into this research?
Yes, I like to say that everybody has a story. And what I mean by that is, I don't know about you, but probably most of our parents didn't say, "What are you going to go to college for?" And you said cannabis, and they supported that.
Two
So
thumbs
we
up.
all, we all got into whether it was healthcare, agriculture, security, business, banking, whatever, and somehow ended up in the cannabis industry. And so that's part of my story. I was teaching actually concussion workshops. And at one of the workshops, there was a clinician who was from California, and he asked me a simple question. He said, when I see a patient on my schedule for the next day for an initial evaluation to assess a head injury, should I reach out to that person at home and encourage them not to use any form of
Mhm.
marijuana before the visit? And the rationale being so I can get a nice, balanced, and fair assessment of their reactions, their visual perceptions, their memory recalls, all the things that we look at when we assess concussions. And I said, yeah, that sounds like a really smart idea. And he said, well, what about if we do that and then we're treating them for about, say, 10 days and their symptoms don't subside and they still have things like migraines and difficulty falling asleep and anxiety that are related to this head injury? Should I then tell them to use a little bit of marijuana? And I was pretty sure at that point my answer would not be yes, that's the standard of care for concussion rehab. What was really interesting is those three symptoms that he at least alluded to, the anxiety, the difficulty falling asleep, and the migraines, are three conditions that in the 39 or so states that have legalized medicinal marijuana are indications for its use. And so I try to figure this out. Well, how could these possibly be also three of the 22 items on the concussion symptom checklist, but three conditions that are indications to be treated with marijuana? And when I started looking into this, it's very fascinating. And the first thing I realized, to be honest with you, is that most of us in healthcare have absolutely no idea about cannabis. We're educated from back when, and it wasn't from school. It was just this is bad, it's illegal, so on and so forth. And what I started realizing was that it was, as you know, especially in the States, becoming more acceptable and more accessible. And the younger generations weren't viewing cannabis the same way that the older generations were. Basic policies and laws were loosening up, and use was becoming more prevalent. They weren't worried as much about drug testing issues. But what we were also finding was, and I call this an N of one, we really don't have great clinical trials, but there was an awful lot of individuals that I was crossing paths with. They were telling me, hey, my neighbor gave me this topical or this oil or this gummy, and it worked. And I don't have these symptoms anymore. And I don't have to take these drugs that I've been taking for 10 years. And so, you can call them all crazy or you can call them all placebos, but the truth is something is there.
Mhm.
And so, my interest was first and foremost educating, because if you were treating a patient for any condition, you always want to know, well, what I'm doing, is it working or not? And what else are they doing? Who else are they interacting with? And if they're interacting with another healthcare provider in any way, shape, or form, how is that changing the outcomes of what I'm doing? And what I was finding was that they weren't telling their providers that their neighbor or their relative gave them this, but it was working. And so here I was thinking, oh, that's my treatment that's working. And in reality, it was something related to cannabis. The biggest problem is everybody's self-dosing. They don't have
Mhm.
any idea. And what I start to realize, and I think this is going to be the premise of the presentation, which I think is really exciting, is that dosing is everything. right? You have to decide, what is my condition? What's it indicated for? And is it really a reason I should be using THC or CBD or CBN or CBG? And the list goes on of the minor cannabinoids. And then if there is a reason because that cannabinoid is associated with helping this condition, how much do I take? And what time of the
Hmm.
day do I take it? How many times? And these are all normal questions you would have. I like to ask people, if you have a headache and I give you a jar of ibuprofen, how many do you take? And most people I talk to say two. And some will say, well, three, maybe four at the most. And I said, why not 10? And they said, well, that's not good. Well,
Hmm.
that's the same thing that's happening with people who are self-dosing. They really have no idea. They just know if I take too much, it's bad. And that's actually what we're finding out. The people who use low doses for the right reasons, the right indication, can actually find benefits. But the reality is, most of the athletes that we work with, when I ask them, oh, well, do you stop at this much? Of course not. They just take more and more and more, and they think more is better. And that's where we start to see the changes in their performance, mostly adverse actions of reaction time,
Hmm.
vision, cardiovascular, of course, if they're smoking.
Yeah. Yeah. And I think, one of the most important things that you brought up is, right, there's a lot of changes in legalization and accessibility of cannabis. And so we as clinicians are much more likely to be seeing patients in our clinic who are using cannabis to some extent, right? And the question is, do they even know what it is, right? If they're getting it from a dispensary or some sort of legal means, or, or do they not even know what's in it? Do they not know the origin of it? But, if you could, tell neuropsychologists, one or two most important maybe questions or things that we might want to talk to our patients about when they're coming in, right? This is in the context of a much longer clinical interview, and we just want to make sure that, at least for now, we're hitting on the main points related to this. What do you think that the clinician should be aware of or be asking patients about?
I think the top two would be, the first is to build a trust. And of course, that's important anyways when you're meeting one-on-one with a patient and working with them on personal issues. But I think this has always been a taboo topic, and they're uncomfortable talking about it. And especially an athlete in the context of a
Hmm.
team, they don't know who works for that team. Who's going to tell the coach what I just told you? And so they really have a hard time trusting. Now it's become a little bit more open as education's become more acceptance to these programs with athletes. But I think the first thing is, historically, you see them after the fact. Well, I'm using marijuana, but now something's wrong. So now I need to come see you. And so you're backtracking to build that trust. I think that's number one. The second thing is that I've realized, and this is my space, I really, really try to stay in my lane. I'm not a neuropsychologist. I'm not trying to understand the rationale of why they're using it, what trauma is in their life, and things of that nature. What I try to do is tap into their identity. And as an athlete, their identity is that sport that they play, and maybe even dive deeper into the position that they play within a sport. And so, for example, if I'm working with an intercollegiate athlete, I'll ask that person, so you play football here. If you weren't playing football, would you be here at this school? And most would say no.
Hmm.
And so I said, well, so then you're here to play football, and I assume you want to play your best. And I assume that when you walk around campus wearing the jacket with the logo on it from your team, you want people to know you're on the team. So therefore, you want to play. You don't want to be third or fourth on the bench and really never get your uniform dirty. And when you tell them you play, and they look at you and say, well, I don't ever remember seeing you out there. So what can you do to perform your best? And did you know that despite getting up at 5 a.m. and lifting weights and having a nice nutritional plan and having everybody else there work with you, athletic training, physical therapy, whoever's helping you, when you use these products inappropriately and with wrong doses, you're negating all those gains and in fact creating adverse situations. Why would you want to do that? And so I try to tap into the identity of what's important to them, which is playing in their sport and succeeding that way.
Hmm. Yeah, kind of framing it from that performance mindset. It's often a
Yeah.
good way to, I think neuropsychologists have found that's a good way to get the foot in the door for a lot of things like sleep and, other kind of concerns.
Yeah, because you think about it, the old-fashioned method of, well, don't use it, it's bad. The abstinence message isn't going to work. And if I say, well, if you keep smoking marijuana now when you're 40, who knows? They don't care about that. They
Hmm.
want to know now. I want to be, the person now. And that's been my success, at least from my opinion, what's worked well with those that I counsel with from an athletic perspective.
Yeah. Absolutely. Well, Dr. Konin, thanks again for speaking with me. I know I'll be looking forward to learning more about cannabis in the brain at the SNS Symposium in Cleveland this May. I have a feeling many of my colleagues will be bombarding you with questions because this is such an interesting topic, and something that we, like you said, we don't get formal education in. So those listening can read more about the conference and register to attend on the SNS website, sportsneuropsychologysociety.com. And you can also follow SNS on Facebook and Twitter. And we're looking forward to seeing you all at the 14th Annual Concussion and Brain Health Symposium, May 14th to 16th in Cleveland, Ohio.